Hey, everyone. It's me, nurse practitioner Dr. Katina. Before I go in and tidy up something in the office, I wanted to come to you all because something came to my mind. When my patients come in with recurrent bacterial vaginosis or recurrent yeast infections, some of the things that they don't think about would be, and I'm saying these tips for you all to think about these things, would be more so of, do you use scented toilet tissue? Does your toilet tissue smell good? What about your soaps that you use down below? Is it unscented? Also, panty liners, maxi pads. If it smells good, don't use it down below. That's right. I've said that plenty of times for you guys. Don't use it down below. Your washing powder, anything that's scented, because it may cause a change in the vaginal pH, which can cause the overgrowth of the bad bacteria and the yeast. Also, check your partner's tongue. I've talked about that before. Have him or her to stick out the tongue. Take a look. If it's white coated, well, we do have a slight white coat over our tongue. However, if it's severely or moderately, you can tell the difference. Come on now. If that tongue is really, it has a lot of white coating to it, then they may have an overgrowth of yeast on the tongue. And guess what? That can cause and if you also notice a trend of when they, perform oral sex on you, and all of a sudden, you got a yeast infection or you got a bacterial infection. It may be something going on orally with your partner. Another tip that I want you to remember is sometimes the semen throws the vaginal pH off. So be careful with that. And also, if you do have a partner that's not circumcised, that's right, uncircumcised, you may get recurrent yeast or BV if they aren't treated, because underneath the skin. Now, your regular partner, the research says you can't transmit yeast, right? But when it comes to the uncircumcised partner, underneath that skin, guess what? Yeast, bacteria can reside underneath. So they have to take measures to make sure that they dry themselves really good. And you guys have to make sure it's no yeast underneath the skin as well. So these are just some tips that's not obvious that I want you to make sure you evaluate. And if you need a consultation with me, you can set that up. Nurse practitioner Dr. Katina. See you next time. Share.